Good morning, and thank you all for being here today. Thank you to our guests who have joined us to share their experiences. I look forward to hearing from them here shortly. Thank you to our friends at the Economic Security Project for their work today as well. Nearly 71 million Americans rely on Medicaid for their health care coverage, and they are facing cuts to their care and increases in their monthly premiums. Employers are already anticipating that they will have to raise the cost of health benefits for their employees next year. Prices are too high already. And the budget bill that the president signed into law isn't helping matters at all. I want to be clear on this. These cuts and these price hikes are a direct result of the Republican majority's choice to pass a strictly partisan budget bill. These cuts mean longer wait times at the emergency room, higher costs for treatment, longer drives to the doctor's office. In rural communities like mine, where more than half of my constituents rely on Medicaid for their health coverage, we will face clinic and hospital closures, increases in monthly premiums, and working families will be forced to go without care. The Protecting Health Care and Lowering Costs Act would reverse the Medicaid cuts and extend the Affordable Care Act's premium tax credits to prevent a spike in health care costs and protect health care for all Americans. Next to housing, health care can be the next largest line item in a family's monthly budget. It's essential that we bring this legislation to a vote immediately to protect access to care for millions of working families. I urge my colleagues on both sides of the aisle to join me in supporting this legislation and showing the American people we're serious about lowering their health care costs and protecting their coverage. Up next, I'd like to introduce an incredible leader within our caucus, a fellow Californian, Chairman Aguilar.
Thanks, Adam. Appreciate you. Good morning, everyone. I want to thank Congressman Adam Gray and the Economic Security Project for hosting our event today, and the brave individuals behind me here who will share their stories about their experiences with healthcare in our country. As you know, earlier this summer, Donald Trump led Republicans in passing the Big Ugly Law. This administration's signature achievement gives tax cuts to billionaires like Elon Musk and Jeff Bezos by taking food away from hungry children and ripping healthcare from people who need it most. Republicans know how unpopular and cruel this legislation is. They've spent the last week attempting and failing to rebrand this bill as something centered on workers instead of the elites that it truly represents. But the American people are too smart for that. They know that the Big Ugly Law is making our country, our economy, and our society weaker. Democrats know that it's too late, that it isn't too late to protect Americans' health care, and that's what this effort is about. We just need a handful of Republicans to join us in undoing the damage that they've inflicted, and that starts with legislation like the Protecting Health Care and Lowering Costs Act. This bill would reverse the cuts to Medicaid in the Big Ugly Law and permanently extend the ACA premium tax credits that have been a lifeline to so many families like those in my district. Right now, nearly 400,000 people in my district depend on Medicaid or receive a premium subsidy. Unlike Donald Trump and Republicans, Democrats are laser focused on making life more affordable for hardworking families so they can succeed, not just get by. I look forward to working with each of you in order to get this done. Thank you so much for being here, and thank you, Adam, for your leadership.
Thanks very much.
Thank you.
Next, I'd like to bring up Representative Frank Pallone of New Jersey.
Thank you. Thank you, and let me thank Adam Gray and all the sponsors here and the various groups that are supporting his bill. The Republicans have created a healthcare crisis with their Big Ugly Bill. I don't know how anything could be more cruel to the average American than what they've done in cutting Medicaid, in refusing to extend the ACA tax credits. I mean, I'm back in New Jersey, and the filings that have already had to be in place for the insurance companies for our marketplace have already been made in August. And the media has been drawing attention to the fact that for many people who maybe now are paying only $100 a month for their marketplace ACA coverage, may end up paying $300 or $400 a month and will not be able to afford it, and therefore will go without health insurance. And the same is true for the Medicaid cuts. We're seeing hospitals close, we're seeing community health centers close, particularly in the rural areas of the country. So this idea that this may not happen right away, this is happening now. The crisis is now, and you're seeing this as we speak. So all we're saying in this legislation is end this healthcare crisis. Get rid of these Medicaid cuts that were in the big ugly bill. Address the ACA tax credits that need to be put back in place. I would make them permanent, which is what this bill actually does. And I have to tell you right now, I know all the discussion is about the spending bill and what's going to happen by the end of the month. I'm not voting for any spending bill that does not address this healthcare crisis in a serious way. We owe it to the American people to address this. It's an affordability issue. The biggest problem that people tell me about affordability is the inability to pay for healthcare costs because they keep rising. And this bill is the answer. Let's get it passed. Thank you again.